been with us before in this seminar, I'm just going to explain the basis of these seminars. And what we are really sharing is not a list of things that you should do, i.e. working with health or working with education or something like that, but more to discuss ways of working better and ways of working in place-based approaches. So if we just pop to the next slide, please, Louis. What we've identified is that not all places are adopting a similar approach, and that some places are keen to integrate physical activity into other sectors, to strengthen communities and individual capacities, and in some cases also working across with other colleagues to try to tackle some of the real root causes of physical inactivity. But we've identified that there are sort of 10 common cross-cutting conditions across that work, which is about these better ways of working. And I'm not going to go into the detail of that now, because hopefully you're aware of that, or you're becoming aware of that, or if you are interested in some of the detail behind this, then I think Emma's just put into the chat our sort of brief couple of page explainer of this model that helps to explain why we think these conditions are important for really creating that change. But as you know, the one that we're going to focus on today is the capacity and capability across the workforce, volunteers and communities. So just pop to the next slide. So I think before we go on any further, what we're going to do is just to put you into very, very brief, 5-minute breakout groups. You'll be with 3 or 4 colleagues. And what we'd like you to do is just quickly introduce yourself to those other colleagues, and also just to capture a quick reflection on what does it mean to you in terms of like the capacity and capability. What do you think that means, and what are you hoping to get out of the session today? Just to have that discussion with some colleagues before we go into the main content of the day. So Emma, is it all right if we do that to send us onto those breakouts now? Right. Great. I can see everybody coming back in. I hope and trust that you had some interesting conversations with your colleagues about this topic. Okay. I'll just reflect a little bit while we're all coming back in on the conversation that we had, which was, recognising capacity as a challenge for everybody, but thinking about how we can work smarter, better, how we can think about how the skills and the opportunities across a wider workforce, how we can enable people within communities to work differently and with us as well, were some of the kind of key themes. So without further ado, I'm just going to pass you on to Louis now, who's going to talk through some of the findings that we as the National Evaluation Team have come across. So over to you, Louis.
Thank you, Katie. And yeah, thanks to everyone for joining today. So my role isn't to talk for too long, but to give a bit of a summary of the essence that hopefully you guys have had access to if you've not read yet. So we're just going to briefly go through that, because I think the most important people speaking today are Jaspal and Claire to speak about their examples. So to begin with, capacity and capability across workforce, volunteers and in communities. I don't want to talk too much about this, but in terms of what do we mean by capacity, about building capacity for either communities, the workforce in communities, about addressing the need for more resources, whether that's time, funding. We've got examples of seconded staff, people embedded 1 day a week or joint funded roles to help build capacity and to support better infrastructure within organisations when we talk about going for a whole systems approach. And then capability, we talk about the increasing the skills and the knowledge of the workforce. So we might build capacity through that embedded staff member within an organisation, and then they provide training and mentoring and support to increase the skills and knowledge, and again working towards that whole systems approach. The key dimensions that we'll talk about within this 10-minute slot, and really key things that have come up, and for those of you that have been involved in contributing to NELP with process learning reports, conversations, NELP cluster groups, anything like that, this has all gone towards this. So essentially this isn't something that we've come up with. This is something we've almost synthesized and just regurgitated out of the work that you guys have done. So I would be amiss to not say thank you to everyone for any contribution towards this. So the first one of the key dimensions around developing networks, so community and/or professional networks that encourage active participation, providing training that aligns to the values and the cultures, strengthening competency and awareness of the workforce, and allocating resources that are equitable and proportionate. And we'll go into these in more depth. So the first one around developing community and professional networks. Now, we've seen loads of this going on at all different levels, upstream, downstream, in terms of professional stakeholders, key funding pot holders, key decision makers, all the way down to community practitioners, people that just want to engage informally, whether that's, say, a cycling group or a walking group around mental health. All of these networks that are around encouraging active participation, and that contributes valuable insights and expertise to why people want to how people might become active or want to be active, as well as the potential barriers that challenge them, and how we can support in terms of building capacity and capability of these individuals. And then these networks can be formal and informal. We see lots of conversations that are over coffee, 5-minute chats in the hall, and we've also got big community of practice and forums where we get together and everyone sits around with a formal agenda. There is no right or wrong way to do this, but it's about what works for who in your context. In terms of training, we talked about this in our breakout room as well, and it constantly comes up around what we're providing training to individuals, to groups, to organisations, and Jaspal and Claire are going to talk about their examples shortly, which will bring that to life a lot more. But it's around aligning it to the values. So what is it that the workforce wants? What do volunteers, communities want? And how is this being tailored to their specific need? So a key question that we might reflect on is actually, how do we know what training is needed? Is it a case of we've seen some training, we're going to provide this, it looks great? Or has there been like a demand? We want some training around this area. We want to know about systems leadership. How can we come on this journey with you? Strengthen competency and awareness. So how does the workforce understand how structural inequalities influence physical inactivity and how it can be mitigated? So there might be some short-term wins mitigating some of these inequalities to get people active, or to get people to buy in, or just to engage with organisations, and then other work being done to overcome structural inequalities. So lots of training, support, capability, capacity building isn't around physical activity directly, but around overcoming these structural inequalities, whether that's cross-sector work to say, actually, what are the root causes of inequalities? We need to focus on housing, we need to focus on education, and like Katie mentioned earlier, there is no right or wrong way to do this. There is no set list, but potential different factors that you might account for in your place, what's needed most to sort of overcome these things. So training, again, might be coming into that. It might be an embedded staff member. It might just be an awareness or an understanding of a different way of working, which I think over the last, within my involvement anyway, seeing a real shift into focusing on this type of work shows that awareness and that competency is definitely growing. Allocating resources that are equitable and proportionate for communities and volunteers, as well as supporting organisations to adopt equitable policies and practices. Now, this might seem quite simple and quite obvious, but actually doing this in practice is a challenge. Lots of red tape around how money might be able to be given out to communities and the challenges there. So potentially funding pots that need to be spent by the end of the financial year being stopped because of red tape, whereas a community or an organisation that would really benefit or receive it proportionately, it won't be able to, say, receive that funding because they haven't got the the correct processes in place. They haven't got the right safeguarding or risk assessment in place. So consideration around these things about how can we overcome these things, what capacity needs to be built or capability needs to be developed so that these organisations, these community groups can access what we've got, as well as potential for these community organisations all the way up to big local authorities and national governing bodies around equitable policies and practices and the challenges that come with that as well, making sure that we're giving everyone the opportunity and it is equitable. And that, again, these 4 key dimensions all link into each other and all support each other. So as we move forward, these are key things that we see influencing building capacity, building capability across these target groups. It's not to say that this is the extensive final list, and actually as we keep going there might be more things that come up, and part of the reason that these learning seminars are so useful for the team at NELP as well as everyone attending is actually different new examples, new key dimensions that might come up, and again helps us to then support and influence moving forward further things that can help. So Katie, I can't see the chat or anything, and I don't know whether you want me to come off the slides because I can't see faces, but it's an opportunity before.
Yeah, come off the slides, Louis, just so that we can prepare the next set of slides anyway. There's been some sharing in the chat regarding, I think already people connecting up in their breakouts about examples they've got, toolkits and things like that. And Jan's shared something. I think there's some other option, something that Shion was talking about from Newcastle as well. So there's no specific questions on the content. We do have a question from Justin, which is about working from home, referencing Coventry Uni research regards to where working from home might be making people less physically active. It could be, focusing people in a bit more on a geographic location. So I don't know, Justin, if we've got specific examples to refer to on that, but if you've got anything you want to share with the group now from your point of view regarding, that's providing more capacity or less capacity, do feel free to just unmute and to share that now.
Thank you. It's just a quick, it's just a thought I had really around, sorry, hi, but it's a thought around the volunteering aspect of this. Locally, personally, I work nationally, but locally I'm more connected now, and it's an opportunity for volunteering. I don't volunteer, I can just help out as around, but my point is, because I work technically from home, I'm doing less travel, less active travel, so there's less physical activity in my life, if that makes sense, or could be, but I've got time. So the time part of it then, I just wondered if there was anything suggesting that place-based working is seeing, more professional individuals thinking about that and taking up the opportunity to become, connected to the local community and more physically active through place-based working. But it was just a thought, because it's there in the sense of an opportunity to become more active. But I wonder if people are taking that opportunity, especially those that live in a block of flats, for example. They work from home. There isn't much around them, but they need to connect to something in order to, if they can't afford to go to the gym, etc., that sort of thing. I just wondered.
It's an interesting observation. It's not something that springs to mind that I've seen in the place-based work, but I could be wrong. And if anybody from that's really involved in this work already does have an example of that, do feel free to jump in. But otherwise, I think we can probably just think about that as as the world changes, as the context shifts and changes, what opportunities and/or challenges does that present with regards to people's time, capacity, capability, etc. So it's those kind of reflections that we're keen to hear. So thank you for that, Justin.
Katie, just on that, and Justin, I don't know if it's too relevant, but from some conversations I've had, I know based off of things like the asset-based community development training, that people have looked to take up like volunteer roles local to them, but it's not like a mass thing. There's just a few odd examples, and again, it's not necessarily about being physically active, because some of them have been like the food banks, things like that. Some of them have just been like engaging more in the local, so I want to say like parish council work. So yeah, I think that's a really interesting one, and I'm going to make a note of that, because as we look next at the process learning reports in the next phase, something to consider as well.
Great, thank you. So should we turn to Claire then to sort of introduce some of the examples from Greater Manchester?
Yep, hi everyone, thanks Kate. I'm just sharing my slides, can everyone see that? Yep, someone give me a thumbs up.
All good.
Brill, thanks everyone. Right, hi everyone, thanks for inviting me here today. I'm Claire Tomkinson, I'm Strategic Lead for People and Leadership at GM Moving over in Greater Manchester. We're the active partnership for Greater Manchester and working to change lives through physical activity, movement and sport in our place. We've got a 10-year strategy up to 2031, and obviously we work really closely with Sport England on the Uniting the Moving strategy up to 2031 as well. Within that, we're working collectively around the 5 big issues: recover and reinvent, connected communities, health and wellbeing, children and young people and active environments. But you've noticed I've put the people and leadership right in the centre of that, because I don't think we'll achieve our vision or achieve transformational change across those big issues without having a workforce, both paid and voluntary, that's got the skills, the capabilities and the capacity needed to work and lead in different ways. And we've been talking about capacity and capability for place-based working since about 2020 in Greater Manchester. So I'm going to tell you a little bit about that and a bit about the challenges that we've faced over the last couple of years as well. So when I talk about people and leadership, what do we mean? So we've got that shared ambition of realising the power and potential of a movement of people that's reflective of the population, so digging into those inequalities that we see, to inspire, engage and support people to live more active lives. And basically, like I said before, I believe that it's people that inspire, support and motivate people to move more, that building movement back into daily life and reducing those inequalities is really complex, and I'll talk a little bit more about what that means in a minute. And therefore we need to support the workforce, both paid and voluntary, to work and lead in different ways. And one way we've been doing that is through our systems leadership approach. A big part of that is involving to support enable a transformation in the knowledge, skills and opportunities of people paid and voluntary in Greater Manchester to work and lead across sectors and within communities around the shared purpose of changing lives through activity, movement and sport. And for the definition of systems leadership, if anyone's not sure what I'm talking about, we've been doing a lot of work with Debbie Sorkin from the Leadership Centre. I discovered Debbie in a previous role in about 2016, where I'd thought for a really long time that leadership wasn't for me. It was restricted to a really small number of very important, very clever people. But to kind of discover this way of working that's about that collaborative leadership, that networked approach to leadership of people in different places and different levels, creating that shared purpose and cooperating in a place to achieve change, that was something that felt like really resonated to me and the work that we were doing, and also some of the challenges that we were seeing as well. And why do we need systems leadership? I really love this diagram because it puts the person in the centre. But one thing we've learned beyond anything else over the last few years is that being active and moving more is not just an individual choice. It's not just down to personal motivations and willpower and making the right decisions and all of that unhelpful language that we hear quite a lot. And we know that there's loads of factors and loads of inequalities that have an impact and are putting barriers in place for people's ability to move more. We can't talk about activity and movement without talking about social connections, transport, education, housing, health, green and blue spaces, policy changes. It's all connected. So what we've been doing is looking at the capability and capacity needed to work kind of collaboratively, how you work across all of those layers and with all of those organisations and sectors when you're not in charge and you don't have positional power or authority. It's a very different skill set. So here's a bit of an overview of kind of the last phase of our systems leadership approach, just as a bit of a snapshot. It ran from April to December, so this is kind of like that period of time. In that time, we engaged 198 individuals from 98 different organisations across Greater Manchester and beyond in 32 different sessions. And you can see a bit of a breakdown there of the kind of sectors and background that people came from. The message was very much, you know, you're welcome to join us. It's cross-sector, open to anybody. if you feel like movement matters to you in your work. And if you think about that onion diagram I shared briefly before, we've got a really nice overview of people from health, voluntary sector, sports clubs, NGBs, local authority, local residents and other active partnerships who came along to see what we've been doing as well. In terms of the training, it was really important to us that we didn't really start with a plan. We did an introduction to systems leadership session to start with, just to get everyone on the same page, and then designed the rest of the offer around kind of like what resonated and what people felt was important to them. So we did things like how you work through uncertainty and change, how you approach governance within a complex system. We've done a lot of work around values and behaviours that I'll talk about in a minute. We did some work around public narrative and framing and how you tell the story of the work in a way that inspires and engages people to come along and join you in action. We did some sessions around the dance floor and the balcony, so real reflective sessions of when do we need to be on the dance floor in the middle of everything and when do we need to step back and notice who's not participating and what's going on. And we also had a series of TED Talk cinema clubs as well, which were a lot of fun. And the feedback we got back around skills and capacity and capability was that people felt really strongly this kind of renewed sense of purpose, understanding the situation they were in, feeling really motivated, feeling really connected, feeling part of a network, and a real shift in that increase in relationships and connections and knowledge and skills, which was fantastic to hear. But people tended to get stuck when they went back to their organisation, their place of work. And we heard a lot of, yeah, I've got this newfound knowledge and skills and an inspired way of working in different ways to increase physical activity and reduce inequalities. But actually, when I'm going back to quite a hierarchical organisation that doesn't really support that, it can be really difficult to create change. And so two of the biggest barriers that we've seen over and over again is, yeah, we've increased the individual's capabilities and skills. We can demonstrate that significantly. People tend to get stuck with the culture of their organisation and the capacity, as in having the time, the mindset, and kind of like the freedom and permission to work in a different way and to work across sectors and with different organisations. And I think we've done a really good job of increasing the skills of individuals. I think we've done a really good job of looking system-wide, what are the behaviours and skills you need to work in this way. I think we've missed that bit in the middle of how do you do this within an organisation that's got quite a different mindset and pressures upon it. And I think where we're getting stuck is, like, see, if we've engaged 98 organisations in a 6-month period, how do you do that individually within each organisation? One thing we learned that I think kind of like answers this question a little bit, we've probably had about 300-400 people engaged in our systems leadership approach collectively since 2020. Most of them have taken part in our values workshops, where they've worked with a leading values practitioner for Magma Effect, and have basically, out of a framework of 120 values, get an individual profile of what are your top 10 values that really unconsciously drive your work and behaviour and decision making. And then we looked at the shared top 10 values out of a framework of 120 across all 300 participants. And what we can see quite clearly is there's a real strong set of shared values that people want to get involved in this work. So probably unsurprisingly, community support, collaboration, holistic thinking, sharing, listening, trust, friendship, all of those things came up really strongly. And what we did notice is there were a set of values that never appeared at all. So things like tradition, this is the way we do things around here. Territory, this is my organisational priorities and our focus. Hierarchy, you know, there's a set process. Control and status were things that never appeared within our participants. And I think what we've found is we've attracted, I call them the angry mob affectionately, but we've almost attracted a huge group of frontline workers who are quite frustrated and desperate to work in different ways, but are continuously getting stuck within that clash of values. We did some work again with Julian Stodd from around social leadership. He's got a fantastic book if anyone hasn't come across that before. And this slide really resonated with us of you've got like this really collaborative worldview, which is the majority of people who've engaged in our work, where most of the work and the change takes place in those informal networks that we talked about before. we're seeing the clash within the formal structure and the organisational worldview, especially I think with the cost of living crisis, where taking a risk and working in different ways is a bit more difficult than maybe it had been previously. And you can almost see the values in the formal structure of tradition, hierarchy and territory, and the values in the informal network of collaboration and sharing and listening are quite different, and they're bumping up against each other, and they're almost talking a different language to each other as well. So what we're trying to do is help people recognise that, and I'm not saying that one's good and one's bad, or one's right or one's wrong. You need the formal structure, and you need the change that happens at the top of an organisation. You need the informal network and the change that happens when people come together around a shared vision. What I think we need to put a lot more work into is how they talk to each other and how you blend those two approaches and build that bridge between them instead of them just bumping up against each other. And that's why we've been focusing on leadership as really heavily based on relationships, values, trust, and working together around a shared purpose, but how that feeds into the rest of the system as well. So what we're doing next over the next year, we're continuing with that systems leadership approach and those Greater Manchester learning sessions that are open to everybody, because they're really valuable as initial way in. One thing we're going to do quite differently that we've not done before is almost like experiments within the localities, so people can put that learning into practice. And we're theming those around what we call the enablers for change as well, which are very similar to the cross-cutting themes. If we pay attention to these areas, this is where change will happen. So some localities are really focusing on involving local people and growing assets. Some are really looking for help with that effective work across organisations and sectors, because that's where some of that territory is getting in the way. Some are looking at transforming governance processes and having a more equitable approach to decision making. So we're really supporting them with that over the next couple of years. We're going to do some more work around inclusive leadership as well. So working really closely with the voluntary sector to look at what are, particularly around racial inequalities, how do we broaden the diversity of people leading and advocating for physical activity and movement in their place. And two things we're looking at that we've not done before is looking at something around strategic leaders. So how do we maybe do a bit of a 2-day course or session to bring together some of the more strategic leaders across Greater Manchester to say, this is what your staff are really working towards and how it fits in with all the strategies. Here's your role as a protector and a leader to distribute that leadership and give them the freedom and permission required. And also what we hear all the time is the middle managers. And I think the middle managers have such a hard time. They tend to get blamed for everything, this message of everything gets stuck in the middle. So I want to do something around systems change for line managers. If you're that person in the middle where you've got the people that you line manage saying, I want to work and lead in different ways to tackle inequalities and work in a collaborative way. And then you've got all of the pressures from above to do with governance and procurement and reporting. How do we support them? To kind of manage that and be the best that they can. And that's just a bit of an overview of the people that we're working with in Greater Manchester over the last couple of years. So it's a very quick overview of what we've been doing. Has anyone got any questions?
We've got Joseph. Joseph's got your hand up. Beth, I think you had your hands up. I don't know if it was if you also want to come in after that, or if it's been answered, then that's fine. We don't need to go to you. So Joe first.
Hiya. I was just wondering, with these sessions that you talk about, the workshop and stuff, just wondering, like you said, it's open to everybody. How do you go about do you identify the people that come, or how do you advertise it to people to come to these things? And are they a mixture of like online or in person stuff, really?
Yeah, it's a bit of both. And what we tend to do is the ones across Greater Manchester stay online, because we know it's quite a big area for people to travel across. And some of the locality ones in a place, we're doing those in person because we know that's really good for relationship building. I think the thing I've learned most about this is the messenger is as important as the message. So whenever we've got a new kind of like programme or offer of learning opportunities, we sit down and think really carefully around who are the best people to share this. So we have our website with the offer and a bit of a description of what it is, but I'll encourage our voluntary sector partners to share it through their newsletters with a bit of a narrative about why this matters to the voluntary sector. It's gone through Transport for Greater Manchester with a bit of a narrative around why this matters to transport and active environments. It'll go through GM Active and the network of leisure providers across Greater Manchester with a bit of narrative of why this matters to community leisure and the kind of like switch they're trying to make into more of a health and wellbeing approach. So when we've got everything, we'll do the usual things that it goes on our website, goes out on Twitter and all of that, and on our newsletter. But we have a very targeted list of almost like system partners across Greater Manchester who share it within their trusted networks on our behalf, and that's worked really well.
We've got Jan. Hi, Jan. Do you want to ask your question to Claire?
Oh, hi Claire. Hi, nice to see you.
Hi, Jan.
Great to hear about the work again. Yeah, it was just a question, really whether you have or whether you're planning to look at developing toolkit or resources that give more detail on the what of how you've gone about, you know, some of your collaborative workshops and so forth. Just, I'm aware we're thinking about that at the moment from Bradford's perspective, to actually try and find a way not just to share the how of what we're doing, but the what of what we're doing, so that other areas in effect can, you know, build on resources. I just wondered if you, you know, what your thoughts are on that, if you think, you know, it's something you're thinking about.
That's been on my wish list for such a long time. We've got our resource hub at GM Moving, and one thing I'm trying to get much better at is having a people and leadership or a systems leadership page on that resource hub, so we can share, because we've got so many resources now of slides, recordings of sessions. I mentioned before we've got the TED Talk Cinema Club. The reason we did that is we found the chat box was absolutely full of people going, oh, I watched this TED Talk recently that really resonates with this, or I read this book recently which was amazing, I want to talk to someone about it. So we've kind of put all of those together in one place as well. So yeah, I think that is something, sharing it at a wider level is something that we could do a lot better.
Yeah, it's just, I mean, we've been trying to hone down to what were the most effective kind of workshop plans, for example, like how did we go about some of our strategic collaborative co-design sessions in a way that worked, and pulling that into something that's very digestible by another area to be able to look at it and think, oh, that could work for us. Or maybe it needs to be with some actual training or mentoring to support it. Because I know, you know, obviously we've had this amazing experience of 5 years of being able to test and learn, and all the research and evaluation that's behind it. But trying to move towards practical tools that just make it more tangible in a new place partnership area. So yeah, so maybe that's something we could maybe think about, you know, supporting each other around, you know. But yeah, thanks Claire. No, that sounds brilliant.
No, it's fine. What I would say as well is we've had quite a lot of other active partnerships and place partnerships coming along to some of our sessions, and then I've met with them separately and they've took a lot of learning back to their place as well. So a lot of the work we've done with Debbie Sorkin around introduction systems leadership and Jackie around values, I'm seeing that appear in different places of the country as well now. So and that's really nice to see. Also from a Sport England perspective and expansion into new places, I can see that Jodie and Justin, and maybe there's a few others here today, we're also facilitators who are going to be going out into the new places through expansion and sharing a bit of our learning of what it takes to really embed this kind of work at the start. So there's quite a lot going on, but
yeah, no, absolutely, yeah, I'm aware that that's what's going on as well, but they're great just to hear what the thinking is. Yeah, thanks, Claire.
I think just to sort of reinforce a couple of messages there, though, it's like there's lots of learning from the LDPs and place partnerships about the types of sessions that resonate and are really good, but also Claire's point about tailoring it to that audience and selecting what's relevant to them, you know, to really get that engagement. So it's a sort of a, you know, it's that kind of, you know, getting that alchemy right, isn't it? John's got a question. John, you're welcome.
Thanks, Katie, and Claire. Thank you for that presentation. Thoroughly enjoyed it, and I wrote down a little action to try and grab a hold of a few of your slides to utilise that to share our story back, share your story back with the team here in Leicester. Claire, I hate to bring it down to my level, but just in terms of how have you resourced it in terms of, because every time we venture into this world, it comes with extra notes at the end of it that I'm always surprised by. And probably just as important as how do you, and it's probably building on the previous commentator there or questioner, said how do you work out what's what does good look like in terms of where you're getting the best value, because you've got the range of partners there, and it looks absolutely brilliant program that you put on, and elements of it that I think we've probably borrowed in the past as well, and stolen in some of, or built on some of your learning. So I appreciate that as well. You're always very, very generous with your support for other APs, but I wonder if you could give us a little flavour of how you've resourced it, and how do you determine what does good look like in terms of the quality of these innovators, because I think we all spend our time reinventing wheels, and that's a big challenge for our network, I think.
Yeah, it's definitely been, I will use the term like test and learn approach over the last couple of years. In terms of the resourcing, we are really lucky that we've got resourcing from Sport England through our role as a place partner in Greater Manchester. So a lot of that goes into the workforce budget. That's not going to last forever. So one thing I'm really aware of is how we adopt this almost like train the trainer approach of really embedding some skills and capabilities within the system, so that continues and sustains itself over time. So I hear a lot of people going back to their organisation and sharing the learning within their teams, almost just using the slides exactly as you've just described from things they've seen in our sessions. And one thing we're really careful about in Greater Manchester as well is looking at different leadership development approaches that are going on across the system and how we can connect to them. So I also sit on oversight groups of things like the Fairer Health for All Leadership Academy in the health system, the voluntary sector workforce oversight group in the voluntary sector. There's a systems shifting leadership approach within the combined authority and the local authorities. So I think we're quite good at embedding ourselves in everyone else's work, so we can really open that up to a wider audience, and also share the learning at Greater Manchester level of what does really good leadership in Greater Manchester look like, whether it's about health inequalities, activity and movement, or whatever. I think in terms of what good looks like, you know, we've done some things that just really haven't worked at all, and we've done some things. You can guarantee every time I do an introduction to systems leadership session, I'll have 15 emails the next day of people going, my colleagues come back to work and they've not shut up about this session. Can you let me know when the next one is, and can we come along? And that really helps us think that it's resonating with people. If I go back to the original question from Jan as well, because I think it's important. A lot of this, and this question in the chat around consultation as well, a lot of this is based on lots and lots of conversations, lots and lots of listening, and being out in communities and with our partners. When we first started this work, we had no idea that we were going to do framing and public narrative and values and behaviours. None of that was on our radar at all. But from going out and people going, oh, I'm really struggling to talk about the work in ways that connects with my senior leaders, you kind of go, well, that's a framing and a storytelling issue. So let's go off and explore that. And that wasn't the language that they were using. So I think there's something about not being afraid. We called it an emergent strategy. And basically, I mean, we made it up as we went along based on the conversations and the questions that people were asking, and seeing that as a strength, not a weakness, because the way it's ended up now is completely different from how it started back in 2020. And just because that's worked for us in Greater Manchester doesn't mean you could just do these 6 sessions somewhere else and it'll have the same impact.
Does that answer the question, John? I think what Claire's saying is there's an element of working smart here as well, working within other opportunities. Maybe that draws me back to some of the points we were making about some of the ways of which we're working here is not exclusive to tackling physical activity inequalities, but sort of tackling inequalities and supporting health and wellbeing more broadly. So thinking about cross-sector allyship, not just for physical activity, but for different ways of working, is also perhaps another way of thinking about resources being used, finite resources being used smartly. John, do you want to just come back?
Yeah, I mean, very comprehensive. You know, thank you both, Katie and Claire. That's really, really helpful. I think the challenge for us as a network is trying to be effective but do it efficiently, and so that we haven't got 43 Claires running about creating their own programs. I get the bespoke part of it, and I'm not ignoring that. I'm just saying that there's core elements that we do that every time I've run a leadership development program. I've gone out and I've tried to determine who could best deliver the various elements of that, but I never feel that I've got real clarity on what does good look like, and Claire's guidance there was really, really helpful, as in, you know, that approach to co-designing that, starting with where it was to where it's ended up, is really, really helpful. Do you know what I mean? I think the challenge we've got as a network is how do we resource that on the scale that we need to resource it on, and that's not for today. So I'll wind my neck in that part of it.
What I've also heard is Jan and Claire, you know, a tentative idea of putting together a sort of curated set of resources, perhaps, that could be made available with explanations of how they've been used and why they've worked. And so we'll follow that up. Jasper, do you?
That's the power of this network.
Jasper, do you want to come in? Yeah. Jasper, do you want to come in here? Because I was going to just go for a break and then come back. But do you want to come in just on this point?
I just wanted to catch John's point around, you know, there's not so many Claires running around, and I'm thinking when we get to the Southwold bit, maybe hopefully I'll be able to answer some of that, because that has been what our approach has been. For me, my key role is when I'm not here, who's going to carry on? So how do you keep that sustainability in the place? So I'm hoping, John, I'll answer some of that question.
Brilliant. That's such a great segue. So what we'll do now is we'll just have a break away from the screens, 5 minutes. So I encourage you to come back at 5 minutes past 11 to hear from the example from Southall. And I have to stress that it's really quite a different example. And so I encourage you to come and keep your minds open with regards to what the breadth of this topic around building capacity and capability, you know, what that can mean. So yeah, 5 minutes if you can, come back at 5 minutes past 11 and we'll hear from Jasper in a bit more detail. Thanks very much for that really engaging session before. Thank you. I can see people returning, screens sort of being brought back on again. So fantastic. I hope you'll agree with me that that was a really stimulating session just before, and lots of food for thought. I'm going to just hand you straight over to Jasper now to explain a little bit about the work in Southall, and they're the ways that they've worked to build capability and capacity. Over to you, Jess.
Right, thank you, Katie, and thank you everybody for coming to the seminar. I'm going to talk a little bit about Let's Go Southall and our approach to capacity building. I think I'm just going to go straight to here for a moment. I don't know if everyone can see this slide. Katie set me a bit of a challenge in the morning and said, bring Southall to life. So I'm going to try, but I'm head of delivery. So I've got a bit of a split role, which is running the programme with my co-lead, Rajinder Singh, and our Assistant Director for Leisure, Chris Bunting. So we do a council role, a programme management role, as you would know it, but I'm also heading up the community, and I'm one of those people in that community there. So I'll talk a little bit later about our hybrid model and how we're trying to bring a working model about blending it into volunteering. But I'm one of those people. Southall's about 100,000 people, and we're activating all of these people through our active communities team approach. So now we'll go back to presentation mode. So best to start with the challenge. There's always a challenge around physical inactivity that we all know exists. We definitely had one in Southall. Our baseline surveys showed that over 43% of people were physically inactive, doing nothing in the week. It's much higher than that since we started doing the work that we do around developing leadership and delivering physical activity campaigns, that actually we know that that's a much higher figure when you start speaking to people and actually start working with them directly in the community. But we believe that lived experience is working with lived experience, or the people who have that experience, is the best way to tackle physical inactivity. Hold on to lived experience, because we really do need to think about how well do we work with lived experience? How well do you know your communities? How well do you think you work in particular areas? Our initial insight, and we've worked with Places with Leadership Centre as well, as Claire mentioned, showed that actually, well, you need to be thinking about the relationship that you have with the community. We found early on that when you speak to different professionals across the system and not in the system, that some of them would ask that question, well, actually, we don't really always know how to go into a community and do that work. There are some, you know, there might be some factors that exist that affect that relationship. So our approach moving on was developing leadership. It's a pure leadership model, but what we want is for people to come forward to say, yeah, I want to change where I live, I want it to be happier and healthier. But what we knew was the voice of everybody, and was the leadership as distributed as we'd like it to be recognised in the system. Ealing has a great voluntary sector, but we were really clear that actually we're not reaching all the communities, and we're not really changing the lack of physical activity that is not only a worldwide problem, but it was definitely a problem for us locally. So the challenge also was that we knew that people don't necessarily have the skills and capacity. We did a great first campaign, got loads of people involved, and since then we've maintained answering that question of what looks good. 400 or 500 people being recruited every campaign phase, getting active, but our leader model has been stable over 4 or 5 years. But as you get deeper and deeper into the community, you have to work with that people don't have the skills and capacity to either deliver physical activity or to do this type of work or even to volunteer. We have a great park run every week, and we've been working really hard on getting people to get up and just understanding what volunteering is and rotate that, do 1 in 3 months. But you know, volunteering is not always a certain things in certain communities. We know the system is benefiting because we're being asked all the time. People come to Southall, they're seeing swamps of people, they're seeing this army of leaders and want to learn. So we know it's working, and we know the system's benefits from learning from that approach. Our solution number 1. I think the slides are moving. We used a Harvard leadership model. So, okay, if the skills aren't there, some people hold the skills. How are we going to tackle this challenge? We thought, okay, the community needs to learn. We need to learn from the community. They need to learn off each other. There's lots to learn about why people aren't physically active. There were people that I really didn't know a lot about, but I've lived in the community for 50 years. And I really thought, wow, you're juggling those many health conditions in your household. So lots to learn. People have lots to learn, and then lots that they can create their own action. At the top of our Harvard leadership model is a self-organising principle, and we built that into our evaluation framework. And what that's all about is that the community itself builds a movement and its own action. It's a leadership model that breathes everyone has leadership as your system's thinking. And I referred to that earlier, that you know, it's not a given that communities, their voices, or the way that they work is built into every community and voluntary sector. Some do, some have some great infrastructure around community and voluntary sector, other places don't, which is what our learning has been. But in the model that we use, everyone that's out delivering, be it in the park delivering an outdoor gym session, or they're running a cycling group workshop, or they're planting on the trees next week along the canal, which is another project that was part of our programme. Everyone has got leadership that we need to develop so they can stand up, go out to their local park and bring other people along with them. The communities it's learning itself with each other. So we've got people teaching each other how to run a meeting, take minutes, take notes, learn how to write down a register, Excel. They're even then bringing out their spices and saying, you know, this is how we make ourselves feel better. This is what's better for our mental health. They're learning from each other. They're teaching others. You are learning from the community. So the system is learning. It's an ecosystem, but all within bringing it into a learning model. Why we used Harvard was that basically Marshall Gantz, who is a professor from Harvard University, his model was all about how to relate to others, which is what we felt was missing, that we are able to work with lived experience, and how to build movements in organisations. So we're an informal group at the moment, hosted by Ealing Council. That's the approach that we use to set up Active Communities team, which are campaign teams, moving to an organisation. So again, that's us teaching other places, how do you build movement in organisations, and how do we harness moral passion for collective purpose? So I'm there for a collective purpose. I'll talk a little bit about that. Harvard has all your standard leadership modules around relationships, around teams, around action, around your public narrative. But most of all, we are in this model for our collective purpose. And as he says, a calling is more interesting, more important than a career. Marshall Gantz, that is. Our hybrid models, so solution number 2, we're creating equal and valued leaders. So that honeycomb model that I showed earlier was about how do you bring everyone in your community on board to say, I want to work with you, but I don't have the capacity, or I'm not able to for whatever reason. Some people are homemaking, other people, English is their second language. Some people are simply just not allowed to come out of the house. What we're doing is harnessing a model where those that are able to give some of their time to do some more professional development around developing their community, doing some systems leadership work, or actually just delivering physical activity and the skills that are required around that can do the work. And then we've also got our volunteering model, which pays some rewards. So rewards and incentives are quite important. It's not enough just to say, okay, come and volunteer. People need to feel like they're doing the work. And then that's why we created the concept of active communities teams, so people actually feel they're part of a campaign, they're part of something that they're working to a collective goal towards, and they're actually making the place that they live happier and healthier. They have the decision-making autonomy, and they're empowered to get data that we can use for ongoing improvement. So that's a really important point. We'll talk about qualitative and quantitative later. I cannot go out and get all the data from people that are getting active with us, the thousands of people, or 500 people a week that are getting active. I cannot collect their stories, neither can any other researcher. But what we've got here is people speaking to people every day. How they record it, how they collect those numbers are the things that we really need to think about when we're thinking about the investment needed for capacity, because some people are not able to fill out a form, they're not able to write X, Y, and Z down, but they can collect the data of who they're speaking to and who they're getting active with what works for them. So they have that decision autonomy, making power to meet every week or every event that they do, team building, their team meetings, to think about how they can present that information back. So some of it's qualitative, some of it's quantitative, and I'll move on to that. But most important, it's sustainable. This is about local people sourcing that change so that it stays in the place and it's their change. We got a skills matrix there, which is all of these skills that I've mentioned, be it from a physical activity intervention, which looks like delivering a session in the park, a walking session, a knitting session, let's talk session. We've got a huge cycling program with people that are now come from going out as a bike lead to becoming a cycling instructor. So a real successive skills pathway. People that have started as an organizer, which we call the voluntary layer around our interdependent teams, to campaign leads, campaign manager. So a whole heap of skills happening there around comms, also mental health delivery. Then they're bringing their resources, and that's what movement building is all about. The resources in the community. Sometimes it's their resources that they bring along, pooling it together and creating that action, their social action. Here's some of our leaders. I'll quickly whiz through them. So here's our leaders corner. So these are our new leaders in Southall. Close to 100 new people that previously wouldn't have been heard in the system, where some of that organisational power is held at an organisational level, not necessarily at the community level of the residents being involved. And I'll read one out from one of our original campaign people that joined 4 years ago. Social movement is when you're given the opportunity to see the difference you make in the world one step at a time. So it sounds pretty bog standard. Of course, we want to make change one step at a time. The key word in there is opportunity. And we're asking questions around investment. We were also lucky with investment that Sport England wanted new ways to do things. We put that right into the heart of people. So all these people you see in all these pictures here are all new local leaders that have been talking about physical activity, designing an activity programme for a period of 4 or 5 years now. And we know it works because the numbers are stable. And every time you come to Southall, you would meet all of these people, 80 to 90 of them, reaching out to thousands of others in the community. So we're really proud of our local organisers and the value that they're creating. Our successive campaigns, we have campaign rounds 6 months where people go out and they do a listening campaign, talk to people, make sense of what they're hearing, what do people in the community want, what's stopping them from getting active, and then there's something around thinking about what that consistency looks like. So the ACT teams are about people in teams looking at either their issues, could be the demographic, which is we've got men active, we've got girl power, so women need to get active in a different way to men. Then you've got people that have got diabetes, or we're trying to get people, encourage them to cycle where they've got a known health condition, working with our local GP practices and our health partners. That's what ACT is about, thinking about your people, what are their issues, what's stopping them from getting active, how do we pull together, and our campaigns are about addressing some of those issues. We didn't go projects and programs. You can't have 1,500 project managers. What we've got here is hundreds and thousands of new leaders that you can be thinking about with an approach where they're in this collective model. The teams are interdependent, so they work with each other. Where you've got men, women, you'll have families. You'll have families that are working long hours, so they can't get active. We have a huge issue with shift work. Most of our population in COVID was knocked out because they worked at the airport. Different shift work, definitely a barrier, but you've got to earn money and put food on the table before getting active. So that interdependent nature and the structure of the teams, what I would say is to think about what are your community issues. Some of that physical activity can be tackled around bringing people together on your issues, creating a working model. We know it works because we've got people doing this week in, week out, delivering over 50 activity sessions a week, which range across a huge platform from being out in the park to cycling, improving the canal, and also online, as well as trying to think where else. You know, our local community centres, everywhere. They're everywhere. They're all across Southall. So we do want to be thinking about the interdisciplinary mindset. So often when we think about the work that we do in the systems, and I'm really glad Claire covered system leadership first, because some of those issues around getting into the system is all the issues that we've had, or are things that are around investment questions. What we were really clear in our approach in Southall was that this needed to be something that was around a people change. So there are organisations that are working organisationally. How do we get people able to take action for themselves? Because they are the ones that are not getting active in the first place. There is a preventative strand needed. There is value from creating preventative measures to the health system, to the whole system in general. We've worked with the Active Travel team to look at why do we not have the infrastructure we need to create more cycling? What changes do we need to make, you know, to cycle lanes, or do we need a bridge here, or are these pavements unsafe? But without those voices, if you're not reaching those voices and having the work going on around it, then really at the end of the day, what you're doing is what I think someone said is that consultation. Are you really getting deep and meaningful engagement from your residents and what matters to them? So in this interdisciplinary approach that we have, we often are the professionals. There's something around thinking about what actually do we bring in the mindsets of our actual community people on the ground. That Southall's got a working model, and it's about bringing those mindsets in and working with the challenges that people face. Just a quick example there, our team runs regular team building sessions. That is sustainability. So where the leads can kind of sit back and think, today we've got a team development session happening. They'll be talking about park run, how do we increase sustainable forms, walking, running. People aren't really getting up at 9 o'clock. We can get them out at certain times, those kind of challenges. And their outcomes from the sessions that they relate back on is how do they deliver better? How do they deliver physical? Are they able to do a risk assessment? And again, these are the things that we then look at. Have they got the safeguarding skills? Have they got the risk assessment skills? But this is identification coming from the communities themselves around something that they probably wouldn't have been able to tackle without having the working model that we've built in to include the community delivering the actual intervention on physical activity. There's a dashboard here, so that every week they collect data. I don't think you can see the data on there. It's probably too small, isn't it? Is it too small, Katie?
It's a little small, but it gives you the sense.
Yeah. So what I mean, and that's what I'm going to go to. Just the headline there is just looking at every week on week. The teams will produce a dashboard themselves that they'll identify around what they want to work on, what's working really well, and they'll rag rate it. And looking at those numbers, it tells them in this phase who they've actually still got active, who's new, what new team members are still on board, and from previous phases. So phase 1 was in 2020, all the way up to 2024. We're in campaign phase 7 now. There's the thread of around, you know, who is it that's not coming into our physical activity sessions. This phase, there'll be a huge work on young people. We've given out cycles as part of our bike programme, so there's some work to do around the young people. But again, these dashboard data runs are done by the teams themselves, and what we have to do is then decipher, okay, does it add up, does it not add up? And I think that's the point that I'm trying to make about the capacity you have to not count out. We can put successive sets of data, kind of analyze it, put it together, but the real skills is being able to get communities to collect that information for themselves, because you will not miss half of your community by using other traditional approaches. For example, we run surveys for our bike programme, half those forms don't get filled out, so there's something around the quantitative side, that we can collect that data, but we back it up with our qualitative approach around collecting stories, listening to people, having our workshop events, and actually really putting together some really good quality data around how people's experiences are changing of being in the social movement and doing the work for themselves. Just a little chart on the community growth, and I think that just backs up some of the network things that we've been talking about. So huge networks going on there. These are people bringing in their own networks, families and friends, but also while we're doing that network work with the community in the system. So with community groups, with health partners, with other activity providers, for example, the London Tennis Association, local housing associations. So all of that system work is happening, but the approach that we really used in Southall was to go directly into the people. So a people's first type approach, because there is a real need for communities to understand as well that the action neighbouring is also going to be how they get happier and healthier. With the pressure that's on the system, we're not able to reach out. There are a lot of opportunities that are missed around physical activity, advice giving, healthier plans, for example. What a better way to do than have someone in your community working with you, talking to you, and actually getting active with you. Leads into that data that we're putting together. Why does it work? So we've got a successive teams models creating interdependency. So they're interdependent on themselves to run, but they can run the program, and community leadership developing. So we can start bringing in new leaders. It works on social movement, shared rights, responsibilities. It hears the voices that might not otherwise be heard, and we're enabling people to build power and solidarity. Within that, we're creating stronger integrated communities where people, whatever their background, live, learn, work, and improve the social infrastructure. The system's coming together to create movement for a common goal, and there's a clear benefit from facilitating collaborative spaces. So I just want to home in on that for a second. We are quite lucky to have had the Sport England funding, but again, that's created that collaborative space to think about how do we work with communities different? What does the system need to think about? And again, you know, we're having the same conversations with our own local councils, being able to see the benefit of engaging the community differently. But that facilitating a collaborative space is very, very important. And obviously it always comes with the zeros, but there's a number of ways. We put a lot of investment into developing our teams. Your campaign design could look more streamlined. It could be a particular issue, but at the crux of it is thinking about developing your community into a working model so that they're able to do that work on a field-based approach with learning going on around it, delivering at the same time. But again, the collaborative space has been really important with its challenges, and I don't think there's any pilot that hasn't had its challenges, but again, I think that's something for us to think about as a system. And the participation levels are multi-dimensional. We've got health upskilling going. There's people that want to develop their work skills, and there's those that want to carry out a personal calling or action. And I think that's really important, that there are those that want to come and volunteer because there's something they want to change in their local community or solve a community issue. And then there are those that want to work in the area of physical activity, sports or coaching. There are those that want to develop leadership skills. So there's a real matrix of skills going on by pulling your community together and getting them to work on some of these issues. Value for local people, wider partners, and understanding the skills transfer from leadership and networks and the relationships. So the relationships I talked about earlier, what is your relationship with your community? Are there issues around trust? What is the relationship between people in communities? We've had to do a lot of work with community leaders. All of that shapes into some of the things about thinking about why does it work and why do you need to do this type of work. I'm going to stop there.
Thank you, Jess. I'm really grateful for you, Jess. What I'd like to do now is just to open the floor for questions. There's a comment here from Justin, but do feel free to either type or ask your questions directly of Jess. But that was really great to hear that come to life again, Jess. I know I've been to Southall, lucky enough to been to Southall and been part of some of the activities delivered by some of your local leaders there as well. Any questions from the floor? Luke, thank you.
Yeah, just put that down. Yeah, brilliant. I think I asked the question before most people came back, and you answered most of it with that, Jasper. I think it was really good. That I think question more of a comment than a question, I suppose. But I think something that we're struggling with, and you said around the leadership walks and stuff like that, something that we're struggling with really is finding the people to have the conversations with. And we've got through funding such as like the Together Fund that we had previously, we've got like links with organisations that meet the things that we need to do around tackling inequalities and stuff, but it's very tokenistic and quite transactional, that relationship, and it doesn't really lend itself to this sort of community-led place-based expansion, I guess. And I wonder, yeah, I struggle to form my sentences into questions sometimes. So I wonder what advice or sort of things that you've done around that, so that it's not like we want to talk to you and then you get this. It's work with us to do it together.
I am going to stop sharing, but I just wanted to go back to why we set up campaigns as opposed to thinking of programs and projects, and why we wanted the community to own their campaigns. So I will stop sharing. In the design, it comes back to the way we designed the program. I think I'm back. Am I back? Yeah, I'm back.
Yeah.
Fight. So, I mean, in Ealing, we did work with Leadership Centre around thinking, how do you go out into the community? Who did we need to work with? And we set up an initial campaign to create the Active Communities team, which would be made up of 10 super organisers and organisers around that would go out and recruit people that wanted to come on board on that cause. So, I would say for us, what worked was to do that targeted campaign work. Just about to think about that in 7, to go out again and think, right, we've got established and trained up leaders now that can go out and do some of the network work that we did in the beginning. You need some of that core skill at the beginning to be able to go out and get your community leaders that can perhaps start those conversations off. So I talked about interdependency there, trying to get everyone into one level, but you need your critical leadership as well, and some of those skills to start any program off. That initial campaign, the aim of it is that people then start doing that leadership work themselves. So you'll have a learning program. That's why I referenced the Harvard. So there's some sort of learning, some sort of space, bringing people together in your workshops, thinking about, for the group that you're talking about, Luke, what are the issues, what matters to them, how do they tackle some of those issues. Some groups are going to be harder to reach out, but again, what's really worked here, not everybody in Southall will come forward and start getting physically active. I think it's helpful to share when we actually start getting into some of the learning sessions with people and they start talking about some of the things that stop them from coming out and getting active. Someone may put something like intimidation, something that means nothing to us. We don't feel intimidated going out into a park, but the people are, Mrs. Patel down the end of the road would feel intimidated just by someone saying, what are you doing in a park? Exercising. What does that mean to us? So the beauty of creating campaigns is that you are bringing people together to shift the power amongst themselves, to be able to have those conversations. There's something around that connection. What's been the top driving force here is more of the social element than the actual physical activity. So people coming together first and connecting has really worked to get around getting people more and more involved and letting that movement organically grow. So our numbers have grown from day one, but around the bringing people together. So there's something in around how you're designed to look for the people who wants to come on board in the campaign. What are your campaign objectives? We started with, do you want to come on board to get people more physically active and change your local area? But from that, it's grown, because then people start discussing and working on their own issues that are personal to them. And often those are some of the areas that are hard to engage, or I don't know, if you're dealing with substance misuse, you're not going to get everyone coming forward and saying, hey, I'll be part of your campaign. Physical activity is a way to bring people together on issues that we can then do work differently with.
Thanks,
Not only are they getting healthier.
Just conscious of time and wanting to give people a chance in breakouts to discuss this with some peers and colleagues as well. I think sort of listening to what you're saying is that difference between consulting or engaging people for a project that you've got in mind, as opposed to sort of working in a community to build that movement for itself in a way. So I think some of the challenges that we have in reaching people to consult on project is some of the timeframes that are imposed by you know, outside influences. So really, like, it's just really interested in sort of reframing some of those ideas. So I'm just going to put into the chat a couple of questions that are actually format wise looks actually horrible now, but let's see how it goes when I post this. They're on the essence that was circulated before. And then Emma's going to put us back into breakout rooms. You might actually end up in a slightly different one to that which you were in before. The purpose of the breakout room is to reflect on what we've heard and thinking about, you know, even if it's just baby steps for some of you, how can we engage the workforce communities, volunteers, understand their assets and build their capability and capacity? How can we ensure equitable training and support? So they're quite long questions, they're difficult, you can't cover them all, but it's starting to really think about that, how that might apply in your setting. So if we do that, we'll go into those meetings, go into those little breakouts for about 15 minutes, Emma, if that's okay, and then we'll come back to sort of share our key reflections. Go there, and then you can kind of scroll through and find it. And if not, just then come back to myself or Louis or anybody else from the NELP team, and we'll be able to direct you to the right things. So last thing for me to do really is just to round of thank yous. First of all, thank you very much for coming. We're really pleased with the level of attendance of these seminars and the level of interest. I know that it's not always possible to come to them when you've got like lots of competing priorities, but I'm really genuinely believe that it's the questions and the ways that you engage with these things that help them to be really successful. So just a great big thank you for coming and spending the time with us today. Thanks to Louis. Louis's done loads of work behind the scenes on this particular condition and really been going through lots of the materials that we have and brought out some of those key points. And I think you can hear those key points that are in that Essence document reflected in the conversations and the examples that are given. So thanks very much, Louis, for all the hard work there. Emma, as always, we can't do this without you. Getting that production right is really great. So I really appreciate that. And then, of course, Jaspal and Claire, your attention to detail, giving us, you know, really bringing it to life and really also sharing not just the things that are working, but, you know, some of those challenges as well. And we're just really grateful. So with 1 minute to spare, I think that's it from me. I just want to highlight that the next learning seminar is next Friday, and that's on facilitative processes. Now, you may look at the title of that one and think that's really boring, but honestly, my team know that that's my favourite. It's not very sexy, but it's really important in this work. So just a little bit of a plug for that one next Friday. We're thinking about how do you actually really oil the wheels of the machine to make it work in a better way for us. So hope to see you all there, and enjoy your lunch and have a great weekend.